Well, good morning, everybody. My name is Kathy Grunling. I'm the Executive Associate Dean for Faculty Affairs and Professional Development in the School of Medicine at Emory. But in this role, I am one of the leads for the Georgia CTSA Collaboration and Multidisciplinary Team Science Program. So these Blue Sky Groups are meant to help enhance collaborations across our 4 CTSA institutions. And we hope that it'll be beneficial today. By the end of the time, by the end of our time together today, that you found someone to collaborate with. So these are unstructured meetings, probably unlike anything you've done before. But we'll have a short introduction by Dr. Anna Woodbury, and I will introduce her to you in a minute. And then we'll talk about, and then each of you will have an opportunity to tell us about your research. And then we'll have a general discussion about things like, what are the burning issues in this area? What are the known funding opportunities? And Anna will help introduce that topic. And then what are the areas where we can collaborate and enhance research in this area? So this is an interactive session. It's important for you to share your experiences, to learn from others, and just have fun. Next slide, Gray. So we do also offer a collaboration pilot grant. It's not very much money, it's $1,500. But if you do meet somebody today and you want to follow up and you need some help setting up a lunch meeting or bringing in a speaker or something like that, you can apply for one of these grants. All right, we will stop there. You can stop sharing, and I'll introduce you to Anna Woodbury, who brought this topic to us. She is the founder of the Division for Pain Management at the VA Hospital in Atlanta. She's been an associate program director for the Emory Multidisciplinary Pain Fellowship, and she's currently vice chair for research in the Department of Anesthesiology. Her clinical experience and research interests include the use of interventional, neuromodulatory, and complementary therapies for non-narcotic management of pain. And Anna, we really appreciate you leading this session, and I'll turn it over to you.
Thank you. Thanks for having me. Thanks for organizing. I know many of the people in this group already, and I'm happy to meet others. So let me see if I can share this slide. Okay, is this coming up all right?
Yes, perfect.
All right. Okay, so the current state of pain research. So this is obviously a critical area of focus and intimately tied to the opioid epidemic. We're still having efforts to understand complex mechanisms of pain and develop effective treatments. And right now there's an increasing emphasis on interdisciplinary approaches. And so we do need to bring together various fields such as neuroscience, anesthesiology, psychiatry, data science. Basically everybody on this call has some input into developing our understanding of pain and advancing therapies. There's also this growing focus on precision medicine and the use of advanced technologies like machine learning and artificial intelligence in pain research. And like I said, there's overlap with opioid epidemic and substance abuse priority areas. So this is a priority for not only the NIH, but also for the VA, the DoD, and other funding agencies. In 1998, the VA launched its National Pain Management Strategy. And in 2010, the Army Surgeon General's Pain Management Task Force report was published. In 2015, the NCCIH Council Working Group report on strengthening collaborations with the DoD and VA was published. And in 2017, actually, there was an NIH DoD VA pain management collaboratory with $81 million of funding over 6 years that went to 12 studies. Unfortunately, that's over. I mean, that specific funding announcement, but I think this just emphasizes that there is this need to collaborate across multiple federal funding agencies and institutions. Some of the federal funding opportunities I wanted to talk about were, of course, the NIH HEAL initiative, which I'm sure many of you already know about. So this supports research aimed at understanding inter-individual differences in pain conditions and developing personalized pain medicine strategies, as well as reducing reliance on opioids. So they have focuses on the transition from acute to chronic pain, and mechanisms of pain for different types of pain pathophysiology, and as well as developing novel therapies. The DoD has the Chronic Pain Research Program. You don't have to be in the military or at the VA to apply for the DoD awards. So this is something that investigators from any institution can apply for. Of course, it is very focused on military health and veterans, but this is available. So the CPRP and related opportunities, so they had $70 million in appropriations from fiscal year 19 to 23. And then the VA opportunities, they're available only to VA investigators. They have several NIH equivalent mechanisms. However, I do want to provide the caveat that you can apply for VA funding when you're not yet at the VA, but the funding is contingent on a VA appointment. So you could apply first and then have a VA appointment later. And then, of course, PCORI. So recently, PCORI announced the Managing Pain funding announcement with up to $12 million in direct costs available for one, like if you can ask as an individual institution for $12 million in direct costs for patient-centered studies addressing acute and chronic pain. The applications are now open. The letter of intent is actually due tomorrow, I believe. So if that's something you're interested in, you would need to get on it pretty quickly. So NIH HEAL, they have projects going in 50 states. This is just a broad overview with the website, so you can look into it later. Priority areas include biomarker development, again, transition from acute to chronic pain, pain management strategies. A lot of these, the MCCIH is involved with. So elucidating biological targets and pathways for complementary and integrative approaches to pain management, such as natural products and mind-body interventions. Mind-body interventions can include like meditation and cognitive behavioral therapy. Neurobiology of pain. So the NIH is supporting research on neurobiology, including studies on like the areas of the brain that are involved in pain. And then the development of non-addictive pain therapeutics. So NINDS is especially focused on this. But NIDA actually as well has several mechanisms to evaluate devices for pain. And then quantitative imaging is another area, which obviously also overlaps with biomarker development. This is just one of the RFAs that is currently available. So this one is to support interdisciplinary research teams. This is the RM1 of multiple PDs and PIs to investigate the mechanism of action of pain relief by medical devices, with the goal of optimizing therapeutic outcomes for FDA approved or cleared technologies. So in talking with these institutes, they are really interested in developing devices that a manufacturer will go after an FDA indication for. So, they're not looking for something that is already FDA approved. They want to know that the company will pursue the indication if you do the research. This is just a little bit more about that one, but you could look it up. Okay, so DoD, this is the website for the DoD awards. They're the congressionally directed medical research programs, and you would look up the CPRP or the Chronic Pain Management Research Program, CPMRP specifically. So they broadly want to look into pain caused by, but not limited to, combat and training related physical or mental stress and trauma, migraines and chronic headaches, traumatic brain injury, arthritis, musculoskeletal conditions, neurological disease, tick and vector-borne disease, and other insect transmitted or tropical disease and cancer. So these are their priority areas: development of non-opioid therapies and methods for treating chronic pain, chronification of pain. So again, that's that acute to chronic pain transition. Like, how does it become chronic? Effectiveness in observational studies of novel or untested techniques for chronic pain management, and implementation science, which actually is one of my weak areas, so I can't really talk too much about it. But if somebody on here is an implementation scientist, I would love to speak with you more. And then comparative effectiveness studies. for evidence-based efficacious interventions and observational studies related to chronic pain. VA funding opportunities regarding pain go through the pain and opioid use actively managed portfolio. And their areas of special emphasis for them currently are studies of fentanyl adulterated with xylazine, harm reduction services and treatment programs that reduce pain medication usage but not complete abstinence, pharmacogenomics and biomarker to guide clinical care in pain and OUD, and then combination approaches, like combinations of biobehavioral and medication treatment for chronic pain in specialty populations, and then clinical evaluation of pain management teams to identify best practices. So for the POU AMP, basically you have to have a primary outcome that is either related to pain or to opioids. And that is really the general gist of that one. These are people related to that funding opportunity if you are indeed interested. Again, you could apply without having a VA appointment, but then you would have to work at the VA at least part-time afterwards. PCORI, again, the LOIs are due tomorrow. But if you do have an idea that you think you could get in time, then go for it. They are only interested in pragmatic trials. You could set up a one-on-one meeting with them, but it's easier to just email them and say, is this an idea you're interested in? Unfortunately, Dr. Sheehan and I already know they're not really interested in our ideas. Definitely find something pragmatic. It needs to be one of these special areas of emphasis, urogynecological and pelvic. Well, it doesn't have to be actually, but these are their areas of emphasis. Urogyn and pelvic pain, pain in individuals living with limitations in cognitive functioning, pain in individuals living with sickle cell disease, and neuropathic pain. It could be outside of this scope, but those are their special areas of emphasis. What else do I want to say about this? They are interested in testing treatments that are already widely available, but not standard of care. Collaborative funding opportunities. Again, there are many. Unfortunately, the NIH DoD VA Pain Management Collaboratory has expired, but I would imagine they might do that again. The International Association for the Study of Pain, or IASP, has collaborative research grants to provide $15,000 for international pain research collaborations. And then there's something called EpicNet. This is not currently accepting invitations, but these were funding coordinating centers for pain studies. And then the Purpose Network, if you are interested in learning about more people throughout the nation who are doing pain research studies, you can join the Purpose Network. I would highly recommend it. It's a pretty neat platform. It's kind of like Facebook for pain research. And it gives you like so you've got like a profile, but it also gives a graphic of the United States, and it has people's individual like face profiles in the areas and in their regions. So you could click on your region, or if you're trying to look for like a collaborator in California, you go to California and you find the individuals in that area who might have a complementary research project. I won't talk too much about that. Okay, so yeah, this is Purpose. So this was just my platform when I went on there, and they have webinars also. So you can see on the bottom here, they have these Purpose Network events. Like this one on the 22nd is about perioperative pain. And then they have other ones that are getting to know your National NIH Institute Center and tips for grant writing. It's really helpful. Now, specific to us in Georgia, there's also this funding opportunity, which is the Georgia Opioid Settlement Trust. They should be open for applications in April. The website is very, like there's not a lot of rules with the submission. You could probably put in a one-page application if you wanted to, because there's nothing that says you can't. But basically, this is because Georgia secured over $638 million from settlements with major pharmaceutical entities, like mainly Pfizer, but others as well, involved to combat the opioid crisis. And these funds support strategic initiatives like expanding treatment options, increasing public awareness, providing naloxone, and it's overseen by the Georgia Opioid Settlement Advisory Committee. In general, you can request up to $500,000 a year for up to 2 years. You could ask for more, but in order to ask for more, you have to provide your institution's financials, which I suppose Emory did, because they were able to secure, these are Emory awardees. There are a lot more from last year. If you go to the website on the bottom of this page with the list of grantees, you'll see how many projects they funded. However, these are the ones that I found at Emory. So the Family Addiction Services was the name of the application. And these are things that really are more related to like implementation and community based improvements to combat the opioid epidemic. So Emory got $2.2 million in year 1, and they will have another 2.2 million in year 2. It looks like Midtown has an naloxone distribution program where they were able to secure $31,500 per year. And then there's also a peer recovery coaches program. So a lot of funds available there, a lot of potential for collaboration within across institutions within the region and within the state. I think that's all I've got. So I'll stop sharing.
Thank you, Anna. That was a great overview. So what we're going to do now is give you a chance to tell us about your research. And what I'd like you to do, I'm going to call on you in the order that I see you on my screen. And what I'd like you to do is tell us your name, where you work, what your research interest is, and any what we're looking for in a collaborator, or what you have to offer to a collaborator, either one or both. So I'm going to go ahead and start with MG Finn. Dr. Finn?
Hi, thanks so much. Thanks for organizing. Anna, thanks for the great presentation. So I'm MG Finn. I'm in the School of Chemistry and Biochemistry and Biological Sciences at Georgia Tech. Our area of interest or expertise is twofold. One is in slow release technologies for drug delivery of small molecules up to large proteins or protein assemblies. We have a unique hydrogel-based platform that can manage slow release of therapeutic agents over weeks or months. Not yet clinically, not in clinical trials yet. We're at a pretty early stage in safety and efficacy testing, but pain delivery is an obvious area. We have an ongoing project in salvinorin with a synthetic chemistry group at Scripps, but there are many other kinds of molecules that might work here. The other thing we also do is a lot of immunology. We're just publishing a paper on anti-fentanyl antibodies, and we're interested in progressing that either for antibody therapies or vaccine development. So those are two areas of interest. We're a synthetic chemistry laboratory as well, so if anybody needs chemistry help, we can usually provide it. Thanks.
That's great. Thank you. Haley, you're up.
Hi, everyone. I'm Haley. I'm in the lab of Dr. Vivian Sheehan. She's actually here with us now. My project specifically focuses on acute pain and sickle cell. So that's involving the investigation of a novel compound for vascular occlusive crisis.
Right,
yeah.
Thanks. Nicholas.
Hi, I'm Dr. Nick Giordano. I'm a faculty at Emory in the School of Nursing. My NIH-funded work really looks at the acute to chronic post-surgical pain transition in older adults based off of disturbances in sleep and immune markers. And so we have that ongoing trial. I'm always eager to collaborate.
Okay, thanks. Don't forget to tell us your institution too. Aaron.
Hi, everyone. I'm a PhD student in electrical and computer engineering at Georgia Tech. My advisor is Dr. Matthew Flavin, and we are working on developing haptic devices to address problems in patient care.
Do you have anything specific to pain?
We are looking to become more involved in applying these haptic devices to address pain. including using virtual reality to, to distract or see other opportunities within how these haptic devices can intersect with pain.
Okay, thank you.
Aaron and I actually spoke earlier today along with Dr. Flavin. So we're talking about some, they can do like pressure and temperature sensation using the haptic devices and like create like sensation and suits. And so Dan Harper with his sensory perception lab like might be a good collaborator as well.
Yep, great, thanks. Laura James.
I am listening to from the Arkansas CTSA mainly to understand how you organize your blue sky group. So I don't have a specific interest in pain other than I'm an acetaminophen liver injury researcher, but that's kind of an off target.
Okay, thanks.
Thank you.
I didn't recognize the name because it's out of context. Carlton.
Yeah, I'm Carlton Dampier. I'm a professor of pediatrics at Emory and am the director for clinical research for our sickle cell program and an MPI or co-investigator on a number of the HEAL initiative clinical trials looking at various behavioral therapies for management of acute or chronic sickle cell pain, and very interested in the acute to chronic pain transition in our pediatric and young adult sickle cell patients, and would be happy to collaborate with folks who are interested in that population as a model for acute or chronic pain.
Yep, thanks. Ashri.
Hi, I'm Ashri Abraham. I'm in the molecular neuroscience field at
Can you
UGA.
speak up just a little bit? You're hard to hear.
Hear me now?
Yes.
So I'm in UGA in Department of Cellular Biology. We're doing cell culture-based assays in a high throughput, focusing on the peripheral nervous system, especially on glia cells. We are mainly looking at the pain contents of fibromyalgia patient, and I was looking at your website, so you might be able to help us identifying blood samples from fibromyalgia patient and using it in high throughput screening in the cell culture based assays.
Thanks, that's very clear. Sheila.
Oh, I can't hear. I'm not sure. It doesn't look like you're muted.
Yeah, you're not muted, but we can't hear you, Sheila.
You hear me now?
Yes.
Okay. Sorry, it's anyway. I'm Sheila Rausch. I'm a professor here at Emory. And I do most of my research is focused on post-traumatic stress disorder, but I also look at pain within that comorbid population, especially in veterans and civilians with PTSD. I do a lot of clinical trials, and I've collaborated with Anna quite a bit, looking at non-opioid based interventions for chronic pain, working with lots of different chronic pain populations. Yeah, so that's me.
Okay, thank you. Daniel.
Hey everybody, I'm Daniel Harper, assistant professor in anesthesiology department at Emory. I collaborate with both Anna and Dr. Dupree Jones as well. My two areas of interest really are in quantitative sensory testing in pain, also known as psychophysics. So, applying very well-controlled stimuli to people and measuring their sensitivity, everything from, thermal, pressure. We even do some auditory and visual stimulation. And then I also do brain neuroimaging, lots of stuff that you can do in the MRI environment. So we do structural, functional, and also some MRS to measure different metabolite levels in the brain. I'm interested in all sorts of different chronic pain conditions, and even have studied some sensory sensitivity issues in autism and some dermatologic conditions. The 3 NIH funded studies I have right now, one of it is in fibromyalgia, and I am interested in the peripheral issues that could be present in fibromyalgia. So I'm very interested. I can't remember who said earlier that they do the cell biology. Yeah, Oshri. It's a very interesting potential there. Fibromyalgia, and then the other condition I'm currently studying is temporomandibular disorder. So people who have persistent pain in the masticatory muscles and surrounding areas on the face, and definitely open to collaborating.
Great, thanks. So Ashri and Daniel, feel free to chat in the chat. Vivian.
So I'm an associate professor of pediatrics at Emory. I'm a physician scientist. My focus is on sickle cell disease, but I do think that, as Carlton mentioned, sickle cell disease is a great system in which to study acute pain, chronic pain, and that transition, because that is something that we see in our patients and actually can model in the sickle mouse. So different things that I do in the pain field is the omics of sickle cell pain, collecting hundreds of samples from our sickle cell patients, doing whole genome, single cell RNA-seq, and eventually proteomics on baseline samples and longitudinal samples, that we capture when they're well in clinic and when they're in the hospital, both those that have acute pain only and those that have chronic pain and may have acute pain on top of it, to see if there are differences in the neurobiology between those sets of patients. As Haley mentioned, we are testing some novel therapies in the sickle mouse model that are intended for individuals with sickle cell disease. And that's some of the work that we do.
Thank you. So as a non-pain researcher, I just want to clarify one thing, because I'm not sure I fully understand it. What do you know, and Anna, maybe you can answer this, what do you know about the transition between acute and chronic pain?
I think we don't know enough. That's part of the problem. That's why it's such an area of interest. There's likely like predisposing inter-individual differences, right? Like, so for example, there might be something to do with emotional state. And there is kind of, I think, Dr. Rausch and I have been working on this paper together. But one of the things that came up was that there was an increased incidence of chronic pain in people who are extroverted and who have, and this is just an association, right? You can't say that this is definite like cause and effect, extroversion and neuroticism. But then it's still unclear. And Nick, of course, is like looking at stuff for related to sleep. So that's another potential area. So I think there's just not a lot known. Does anybody else want to chime in on what they know about the transition from acute to chronic pain?
I mean, I agree with you that it's not well characterized. There's a lot of myths around it. Central sensitization in sickle cell is this term that's thrown around, but the neurobiology hasn't been worked through. So I think we've got a lot of theories and need more data.
Yeah, and then there's this whole continuum of, and the terminology is always changing, right? But with fibromyalgia, this is this chronic widespread pain syndrome. And we still don't know really what causes it, but there's definitely association. So for example, if you look at long COVID syndrome and that diagnosis and some of the symptomatology that goes along with it, it's very fibromyalgia-ish as well, right? And then we talk about Gulf War illness in the Gulf War veterans, and that's another chronic multi-symptom syndrome that includes pain, and that is very much like that would often be categorized as fibromyalgia. And so there's this, they called it central sensitization before, and now it's called nociplastic pain. So it's neither neuropathic nor is it nociceptive because there's not an ongoing painful insult, but it's like this neuroplasticity potentially that has evolved to like change things into this chronic condition where you're always feeling pain, even when pain isn't necessarily present.
Tissue damage hasn't occurred.
Tissue damage. Thank you. Thank you. That's a better way of saying it.
Yeah, fascinating. Thank you. Harold.
There. I'm Harold Solomon. I'm wearing two hats, one Georgia Tech and a small appointment at the new Emory Biofoundry Institute. And my role is not research. I help create startup companies out of the research labs at Georgia Tech. And now at the Emory Biofoundry Institute, we do some of the same work at Emory. We're focused on funding device startup companies across any indication. It can be a diagnostic or therapeutic device. So I'm here basically to connect anybody who needs a connection at Georgia Tech, like the wonderful MG Finn, and the host of other grad students and professors here. I'm happy to help you find your right partner. Thank you.
Thanks. Kim.
Hi, everybody. I'm Kim Jones. I'm a professor in the School of Nursing. I'm a clinician scientist. I study nociplastic pain, specifically fibromyalgia. Most of my early publications were in exercise interventions based on aberrations in the growth hormone insulin-like growth factor axis. So we did strength training, aerobics, flexibility, Tai Chi, yoga, etc. A number of drug trials as well. Industry uses our questionnaire, the Fibromyalgia Impact Questionnaire. The first 4 drugs to FDA, 3 of them made it through. That was exciting, except for the 4th one. And I love to talk to anybody studying any kind of pain, because if we can just add a body pain map, we can often see if there's coexisting widespread pain, which then may push us over into this nociplastic pain category and give us a more textured understanding of what's going on with that pain state. I'm currently employed by Dan Harper. Thank you, Dan. Work with Nick Giordano and Anna, and sounds like I need to work with Ashra too.
Right. Great. Thank you. Martha.
Hi, I am a PhD candidate in the Department of Health Services, Health Policy and Management. It's a very long PhD title. It's PhD in Health Policy and Health Services Research. I work with Nick Giordano and a couple of the folks in HPM, and my interests are largely in pharmacy policy. I've done a fair amount of opioid policy, a little bit of gabapentin policy. And then also I'm interested in the socioeconomic disparities in pain development.
Thanks. And you're UGA or Emory?
I'm at Emory, sorry.
Okay, thanks. Ashima.
Hi, everyone. My name is Ashima. I'm an associate professor within the Department of Family and Preventative Medicine. I'm a palliative care physician clinically at Grady. A lot of my practice is clinical. I'm not a researcher, but I'm interested in expanding my horizon, which is why I'm here today to find collaborations. My particular interest, I would say, in what I do clinically is caring for patients with serious illnesses, and then the intersection of patients who no longer have serious illness, but still have that pain associated with it. And so for patients, for example, cancer patients, sickle cell, when we are thankfully cancer-free and yet still dealing with pain. So those are some of my interests.
Yeah, that's so I don't know if you know of Haley Bowles. Dan and I both know her, but she does a lot of research kind of on that. She's over at Pitt, but on the like kind of ethical management of opioids after remission from cancer. So that might be someone you would want to connect with as well.
Thank you. Haley Wells, you said?
Bulls. I'll message you.
Thank you.
No problem.
All right, Nazir. You're still muted, Nazir.
Okay, now
There you go.
can you hear me?
Yes.
Okay. Hi everyone. My name is Nazir Khan. I am assistant professor in Department of Orthopedics at Emory University. I am working on osteoarthritis, mainly post-traumatic osteoarthritis using mouse and rat animal model. And my focus is mainly molecular therapeutics of osteoarthritis and small molecule based therapeutic potential. I am using G protein coupled receptor, mainly the orphan G protein coupled receptors and their role in osteoarthritis. I am very new to the pain field, and previously we have collaborated with our collaborator Jared Kaiser and Dr. Drisi on post-traumatic osteoarthritis for the pain, mainly the pain behavior, allodynia and mainly allodynia and gait analysis. So I am really new and looking forward to learn more about pain in this group.
Great, thank you. Yoon.
Hi, hello. This is Young. That I'm assistant professor, Emory School of Medicine, that I'm biomedical informatics. So my research focus on the the woman's mental health and the infant neuron development. So I'm particularly interested in how the depression and the pain during and after the pregnancy. Yep.
Thank you. Ernest.
Yeah.
Go ahead.
Do you hear me? Okay. I'm Ernest Alima Mensah. I'm trying to get my face. Yeah, I'm Ernest Alima Mensah, Morehouse School of Medicine. I'm associate professor with the Department of Community Health and Preventive Medicine. But I work directly with the biomedical informatics unit with Dr. Kwashi. And I work with a number of faculty and students, quite a few, and we look at youth rich behavior, suicidal ideation. I'm working with somebody on minority AIDS initiative. I just had an interaction with one of our professor. We're looking at diabetes, looking at longitudinal study. He's one of our new professors. And quite a few projects. So that's I'm always happy and fun with new projects. But I'm based in the bioinformatics, and so all the clinical trials through CRC, etc. My unit is involved in some of those things.
Thank you. Don?
Hi, is it me?
That's you. Yep.
Okay, I couldn't see my own order in the list there, sorry. Yeah, I'm an instructor in the Department of Cell Biology. I work in animal models of pain, and I'm interested in the idea that you can modulate basic sensory signals to maybe alleviate pain or understand their contribution to it. So we're interested in the respiratory system and breathing, and also in sensory afferents, including innocuous tactile fibers and nociceptors. So I'm very much interested in bridging a bit more into the human clinical world and collaborating with folks that might want to.
Thank you. I think it's interesting. We've had a couple of basic science researchers and some HSR and some clinical research, and I think there's some real opportunity there. John.
Hey, John Oshinsky, radiology and biomedical engineering. So I'm here mostly as the person who runs the imaging core lab. So we have 7 Tesla and 3 Tesla MRI scanners. I know several people on the call use our systems. I also have a research project on Chiari malformation, where we're looking at the relationship between brain motion and pain.
That's interesting. I'd like to understand more about that at some point. Anne,
Hi, can you hear me? I'm not sure if my microphone's working. Oh,
Yes,
okay, great. I'm Ann Murphy. I am the acting director of the Neuroscience Institute at Georgia State University as of yesterday. And I have been a long-standing pain researcher. My emphasis has always been on sex differences, and we have a specific interest in early life unresolved pain and its long-term consequences, as well as pain throughout the lifespan and sex differences in both pain and analgesia. And then more recently, my lab has pretty much 100% been devoted towards the long-term consequences of gestational opioid exposure. We've developed a novel preclinical model that we believe recapitulates the teenage female that becomes has an opioid use disorder, becomes pregnant, and continues using opiates throughout gestation. And we look at the long-term consequences of the offspring in terms of cognitive development, immune functioning, propensity for alcohol and drug abuse, and social attachment. So I'm always interested in anybody that needs a preclinical rodent rat person. I'm your girl, and just let me know. And I'm at Georgia State University.
well, great. We're going from cells to animals to people. This is terrific. And congratulations on your new role.
Yeah, thanks.
Nadine. Nadine, do we have?
Good morning, everyone. Yes, my name is Nadine Mathy, and I'm an assistant professor in the School of Nursing at Emory University. My research interest is in the area of pain and self-management in adults living with sickle cell disease, and we're currently evaluating the use of VR for home-based chronic pain management. So I'm really looking to collaborate with individuals who are also interested in non-pharmacological interventions for chronic pain that can be delivered primarily outside of the healthcare setting. Thank you.
I've heard from a couple of people who are potential collaborators for you, I think. Jared.
Yeah, hi. First, thanks, Kathy and Anna, for organizing this. It's great to see all the pain research going on across Georgia. So I am an assistant professor in orthopedics at Emory, and I have an appointment at the VA. I run a preclinical pain, behavior, and function space at the VA, focused primarily on osteoarthritis, but I do work in other musculoskeletal realms, so do some bone fracture, some spinal injuries, and some muscle injuries as well. So my primary focus for my research is reverse translation of biologics and other therapies that have shown some promise in the clinic, but haven't really shown full efficacy. Taking that back to an animal model, understanding what's actually happening, what can we do better, particularly looking at different patient factors within the preclinical model. So looking at either comorbid diseases or age or sex or whatever, and trying to push that back through the clinic. So we have currently a lot of different techniques for rodents, and we're soon to be building out some different techniques for mini pigs as well.
It's interesting take on going backwards instead of forwards with the drug development. Lauren White.
Hi, good afternoon, everyone. I'm Lauren White. I'm actually with SenXL, which is a collaboration of sites across the US, but locally based in Atlanta. And we have two commercial sites here, ACMR and iResearch Atlanta. I did used to work at Winship on their phase 1 oncology team. So I think that's kind of how I got in the mix of this group. But we do phase 1 through 4 human trials, and we actually have 2 on-site surgical suites. So we do a lot of post-op acute pain, mostly in like bunionectomy and abdominoplasty models for testing new pain medications. So just coming here to offer local sites that on the commercial side and just be able to kind of answer any questions and just kind of learn from y'all on what's going on the university side. I sometimes the ability to have a collaboration outside of it is always helpful. So I just appreciate y'all letting me kind of listen in.
Great, thank you. Alex.
Hi, hi, my name is Alex. I'm a research assistant professor at School of Nursing, Center for Data Science. I'm by background, I'm computer scientist and applied mathematician. I worked mostly on neuroimaging before, and I currently working on progression modeling for Alzheimer's disease. And I was just kind of curious to understand other kind of domains where I can apply my models. And I collaborated with Nicholas at School of Nursing for EHR and neuroimaging data for pain. Yeah, thank you, everyone.
Thank you. Janae.
Hello, everyone. I am Dr. Gina Lee, a statistician. I'm currently working as the Associate Director of the Statistical Consulting Center in the Department of Statistics at UGA. I joined UGA last fall, and I'm seeking opportunity for a collaborative research. I have diverse experience in biomedical research, having worked at a medical school and a pharmaceutical company and the International Vaccine Institute. So I have been involved in study designs and precise calculations, statistical analysis, the preparation of a statistical report, and grant proposal writing. So my area of interest spans from medical research to public health. That's about me. Thank you.
Thank you. Svenja.
Yeah, hi, my name is Svenja Elin Younger. I'm an assistant professor at the Department of Orthopedics at Emory, and my research focuses on intervertebral disc, mainly the effect of aging and diets on intervertebral disc degeneration. And I didn't do much pain research yet, so I'm just starting to look into it, and I'm also starting to collaborate with Jared Kaiser, who just introduced himself.
Okay, great. Noah.
Hi, I am a researcher actually in Dr. Wong's lab, who's on the call. I know she already introduced herself. But I am like a post-bac RA, so I'm kind of getting involved and looking to do a career in research. Hopefully looking at infant development and pain as well. But my background is in psychology as well as gender studies, so also interested in sex differences as well. Thanks.
Great, thank you. Let's see, Li Zhang.
Hi, everyone. My name is Lei Zhang. So I'm currently an assistant professor of software engineering and game development on Kansas State University. So one of my research interest is about how to use XR technologies, that including virtual reality, augmented reality, and mixed reality, to help with children with rare diseases. So one major group I'm focusing on is the pediatric cancer patients. So the pain management is a major part of their quality of life. So I'm very interested in how the different aspects of the system design of the app will affect their pain distraction degree or level. Yeah, as far as I know, there are a lot of there's some existing studies of using VR applications in the area for some minor surgery procedures for distraction purposes. So I'm very interested in some more in-depth research in the area, and also about I want to know about the user experience, actually user experience of from those applications based on different design aspects. So I'm just here just looking for some collaborators. I've seen there are some people here also already have some research on that area using VR for the pain distraction, and also a lot of people are from the sickle cell area. So I'm very interested in the collaboration with you guys. just to use the XR as a kind of supplementary therapy for pain relief. I'm interested in different design of the applications and also interested in the effect of combining it with some medicines to see how they help together with the pain relief. Thank you.
Great. We do seem to be getting a VR theme here, VR and sickle cell. Ranaki? Ranak?
Yes, hi everyone. My name is Ronak. I'm a graduate student in Vivian's lab, particularly interested in omics data and identifying pathways that might be implicated in sickle cell chronic pain, with a specific focus on neuroinflammation. I'm also interested in psychiatric disorders in sickle cell and how neuroinflammation, chronic pain, and existing treatment strategies might be implicated in these psychiatric disorders. So if anyone has any interest in similar studies or might have expertise here, we're certainly looking for collaborators.
Great, thank you. Adele?
Yes, hi, my name is Adel Dries. I'm an assistant professor at Morehouse School of Medicine. I work in the Department of Physiology, and my research interest is in sickle cell disease and malaria and the link between both of them. And I work on heme-induced inflammation and microvesicle loaded microRNAs, and I work also with global health. So I'm involved with sickle cell clinic in Ghana and in Jamaica. And so I have access to those patients that I want to. I have just recently, I'm trying to brainstorm about applying those microRNA loaded microvesicle and exosomes technique to study the addiction, especially in when we treat patients with opioids and they get sickle cell patients and they get addicted. So I found few patients that are like that, and they are like in a weird situation that how to cope between the addiction and the abuse and the pain management. So basically, I'm a basic scientist, and so I'm trying to work my way to get some funding and innovative ideas. So I'm really interested. It's very polyvalent, and I like it.
Thank you. Nicholas?
Hi, this is just Nick again.
Oh, yep, sorry, you moved down on my screen. I see, you went third. Sorry. Kennedy? Last but not least.
Hello, can you hear me?
Yes.
Hi, my name is Kennedy Goldsboro. I'm a postdoctoral fellow in Dr. Vivian Sheehan's lab at Emory in the Department of Pediatrics. I'm a behavioral pharmacologist by training, and so I'm investigating novel therapies for both acute and chronic pain and sickle cell disease using a mouse model. And I'm interested in understanding the mechanism underlying the effects of these drugs and the transition from acute to chronic pain as well.
Great, thank you, Vivian. Your lab is very well represented today. So I heard a lot of, first of all, did I miss anybody? I don't think so, but speak up if I did. All right, second, I heard a lot about sickle cell. I heard a lot about the transition. I heard a lot about VR as a potential therapy. Anna, what else did you hear?
Yeah, I heard some hydrogels used in different ways as well, for osteoarthritis, but also for drug delivery, and several people studying the transition from acute to chronic pain, especially in sickle cell. But I think Nick studies it in the post-surgical arena. I'm an anesthesiologist, so I'm happy to collaborate with anybody who's interested in looking at it in the at the acute to chronic pain transition in the perioperative arena as well. And yeah, those were some of the same things that I heard. There's a lot of VR, non-pharmacologic therapies, some overlap with substance abuse and maternal health and gestational effects. And then also the interaction of other comorbid mental health disturbances like depression, PTSD, and sleep disorders.
Yes. So now it's your turn again. So what did you hear that was interesting to you? Where do you think that as a group you have the opportunity, or as a smaller subgroups, you have the opportunity to collaborate? Where do you think the field is going? Maybe get out ahead of it a little bit in terms of what funders might be looking for.
So my primary interest is in devices and sort of non-pharmacologic treatments for pain. So of course, I'm very interested in the VR technology as well. And I'm happy to collaborate with anybody on fibromyalgia if they need access to fibromyalgia patients. You know, Dr. Jones and I already collaborate. I think that some individuals on the call are more like Dr. Lal. I think she's leaving, but may be better at some of may be able to better target some of these pragmatic trials like PCORI or like the Georgia Opioid Settlement Trust, because they are really meant to deliver the intervention directly to the patients. So something that's ready to implement. And I think for us as a group though, XR or VR does seem like a subgroup theme. And then maybe I think that there are several who study perception and then neuroinflammation. So those could also become biomarkers, right? Like there's biomarker development. So there could be like a subgroup that's looking at biomarker development as it relates to neuroinflammation and excuse me, also neuroimaging with Dr. Oshinsky on the call, of course, and others who look at neuroimaging as like a biomarker.
I also think there's some opportunity here. You have multiple preclinical models of pain of some clinicians in the group. And so I would like to see what the group thinks about, are there opportunities there as well? And it's anybody speak up at this point. You can raise your hand, we'll call on you. But we'd like to hear what excited you about what you heard. MG.
Yeah, no, it seems like there's a lot of great research going on across the board. It's really tricky with such a diverse group here to try to distill this into like objectives that can help advance the field across the board. I do think like there's an opportunity potentially here to start just getting organized as to what resources are available. Meeting once I think is good, right? But 10-second blurbs from each person doesn't really do too much. But perhaps it might be good to start thinking about making some databases of individuals and what resources might be available to everybody, especially when we start thinking about trying to put out new grant ideas or like, you know, I don't do much of the pain mechanism type aspect of things, but if I needed somebody for that, if we had some sort of way to look that up and reach out to somebody that way.
Yeah, thank you. You're anticipating the last few minutes of this, which is what you would like to do moving forward, but that's a great idea. Thank you. MG.
Yeah, so thanks. One of the nice things about having people from so many fields is it's a good opportunity to put together a program project that requires such interdisciplinary work. So I'm particularly interested, I know nothing about this, but at the intersection of immunology with pain, it's got to be there. And I think some people are touched on it when they talk about inflammation. I don't know if anybody studies that holistically, but that kind of point of view is perfect for a PO1 style program. So I'm interested in immunology. If anybody, I'm going to reach out to Anne, who I think just signed off for a particular project idea, but if anybody's interested more generally, I'm happy to coordinate and get a meeting together.
Yeah, I was also interested. I mean, part of the reason that I thought this Blue Sky group would be helpful was because I was interested in some sort of like center grant. So like a P series and in the past I had applied for a T90 R90. And we had several of the people on this group were proposed as mentors for this. It was a clinical pain research T90 program. Unfortunately, the feedback that we got was that we were not cohesive enough. So, you know, we had all independently collaborated with each other, but there wasn't a theme. And so if we can start collaborating with each other across, you know, the Georgia CTSA and have like a theme, I think that would be really helpful in gaining some of these grants in the future. And so, you know, like it could be pain across the lifespan as an example, or in your case, neuroinflammation, or sorry, inflammation and the effects on pain. And there are others who are not on this call that I know of who, for example, my colleague Jerry Kalangara, he looks at opioids and humoral immunity. Basically the effect that, so he takes people who have just recently had a vaccine and people who are on opioids versus not on opioids, and sees the immune response and how it is different between the two groups. So opioids kind of suppress your immune system is the, you know, hypothesis that's being tested there. But definitely with pain as well, I think that pain probably like could you know, so one of the things I study is vagus nerve stimulation. And with the vagus nerve, it decreases pain, but it also activates the cholinergic anti-inflammatory pathway. So that's another mechanism by which it can decrease pain. So there's definitely an overlap. So I think it's a great idea.
And Kim, go ahead and explain your comment in the chat.
Yeah, so I just dropped in a link to Emory's Center for Psychedelics and Spirituality. They study pain, PTSD, anxiety, depression, palliative care, sort of existential things around palliative care. But the reason I dropped them in there is they have a particularly impactful website that's very attractive to funders. And of course, most of their funders now are billionaires, not the National Institutes of Health, except for the mechanistic, you know, basic science work. So I don't know how they got to this website, but it's something that I think we could aspire to, so that we could always, you know, put our work out front and center and show that we're collaborating. I'd be happy to reach out to George Grant to see how much of it was just his sweat equity to put this thing together. But I think Anna, with the T99, this was one of the things that would have been helpful, is to have this unified presence. And honestly, there's probably, because we have a monthly meeting, there's probably, Daniel, what would you say, only 20, 25 people at that meeting. It's not a huge group.
Yeah,
And
that's right. Sorry, go ahead. Whoever that was, Dan.
Sorry, I was just confirming it's not a huge group, but yeah, there's certainly an interest amongst that group as well in pain. And you know, the last couple of pain meetings I've been to, there seems to be a growing interest in the use of psychedelics to treat pain as well.
Yeah.
And they have a couple of people with a Schedule I license.
So Alex, you want to explain your comment in the chat? Oh, he left. Okay. We are starting to lose people, so let me move on to the last phase of this meeting, which is basically next steps. So sometimes groups just collaborations develop between one or two people in a group. That's fine. But we're happy to have that outcome. sometimes groups decide there's enough common collaborative possibilities that they want to meet again and do a slightly different format where people actually present their work for 5 or 10 minutes. The idea of setting up a database is a great idea. I love the website idea. That's never come up before. We can also create a listserv so you can keep in touch with each other. What makes sense to you, if anything? Maybe you've gotten what you need and we move on from here. But if you'd like to continue, how can we help support you?
I feel like what might be fun is if we have some sort of forum where like some of these priority areas or themes that are being funded, like for example, acute to chronic pain transition or non-pharmacologic therapies, or like, you know, there's like maybe we'll have 4 multiple choice themes, you know, or inflammation, right? And then people can sign up under those individual groups, like they can say their primary area of interest and they can pick more than one. And then those kind of subgroups can meet. And again, this can create more cohesion around one specific like subtopic of pain that could potentially become more of like a center.
So any interest in something like that? Because that would require multiple people to be interested in continuing discussions. You can just add in the chat if you're interested in that. Any other ideas?
I just said in the chat, we need to work toward being a center perhaps, and we need to know who currently has R01s or similar, certainly P or U awards, so we can, you know, be ready on Friday when the notice of fundings come out, so we can really have our feet under us.
We can probably generate that information from Emory. Be a little harder to get it from other institutions, or we need some help from people who are at those institutions. Or somebody can search an NIH reporter.
Or we could just ask this listserv to fill out a survey for us that lists their current grants and maybe 5 current papers or something.
That's the simple way to do it. I didn't think of the simplest way. Thank you.
Yeah, I don't think we need to set up ongoing meetings right now, but maybe just like a listserv, or, you know, and then see what people are interested in collaborating on.
And does anybody in this room now, are they on a center grant? Anybody led a center grant from this group?
I
We have
have,
a
but
VA center grant for or osteoarthritis preclinical work.
Right, I am in that center.
Yes, you are.
And
I'm in
also
the
part
other
of that.
center too, the Center for Visual and Neurocognitive Rehabilitation. I wasn't thinking about the VA ones. Yeah.
Yeah, the Create Motion Center grant.
we have a suggestion for Slack too in the chat. All right, well, I think at the very least, we will try to gather some more information via a survey, and maybe Anna and Kim's and stuff. Those were your ideas. You can help us decide what needs to be on the survey. And we'll ask you if you're interested in being on a subgroup, what grant support you have. And if you're interested in following up anything in particular. We also ask that you fill out the survey for this event. It helps us understand how to make it better for the next group that wants to do a Blue Sky group. Gray put the link in the chat, so if you don't mind filling that out before you leave, that would be really helpful. Any last words, Anna? Oh, Anna has a phone call.
I'd be happy to work with Anna on that, and I hope this was recorded because it would be helpful to see all the keywords.
It has been recorded, and I also have notes, and I know Anna does too. But Kim, I will ask you and Anna to connect. I don't know that she can hear us right now, but
Anyone else is welcome to work with us.
all right. Well, thank you for your participation and your ideas. Lauren tells me we'll send the recording out to all attendees. If you do decide to do a center grant, just remember the CTSA pilot grants to help you pull that together. This seems like a great opportunity to apply for that. And with that, I think we'll end for today. Anna, thank you so much for suggesting this and for introducing the subject to us, and everybody else for your collaboration and interest in the topic. We hope this develops into multiple collaborations for all of you. Thank you.
Thank you.
Thank you.
Thank you.
Thank you, everyone.